Hi, I'm Suzanne Holliday, and today my presentation is on motivating and developing staff. Currently, there are over 1 million nurses who are expected to retire over the next 10 to 15 years. It is important that managers are looking at ways to motivate their current staff and also develop the nurses that they have on their units to retain their nursing staff to help this nursing shortage to be even less. Motivating staff is one of the most difficult responsibilities that a nursing leader has. Leaders must recognize that each employee is different and is not always motivated in the same way. Staff development begins when a person is hired to a unit and continues throughout the nurse's career into leadership development. The way an employee performs on their day-to-day tasks is determined by two things. One is their natural ability to do the task, and the other one is motivation. Motivation can include things like compensation, benefits, which is a big thing right now, how the job is designed. Motivation can be influenced by the leadership style of the manager, recruitment and selection of the employees, and exactly what the employee's needs and goals are. Ability is just the person's innate responsibility, their educational background, if they're doing continuing education classes, and just their natural skills and ability to do the job. Job performance can be described as their day-to-day performance. How are they doing day-to-day on their job? Are they doing well? Are they showing up for work? Are they showing up to work on time? Are they following the policies and procedures? Are they just trying to do shortcuts just to get the job done? Are they making mistakes or errors? Are they in a hurry to get their jobs done or just not paying attention like they should? And are they honest and trustworthy individuals? We're going to be talking about motivation and how that plays a big factor into how an employee performs on the job. So what is motivation? Motivation really is any factor that initiates or directs behavior. So why do people do what they are doing? Why are they working the way they are working? There are two theories that kind of talks about motivation. The first one is content theory, which basically focuses on the needs or rewards that satisfies those needs. So basically saying that people are working for their rewards. The process theory, which I'm going to go into further, emphasizes more of the motivational process, how it works, how it directs an individual's efforts into good performance. One of the process theories is reinforcement theory. In this theory, it is believed that behavior is actually learned. This is through a process called operant conditioning. Behavior becomes a result of either positive feedback or negative feedback. Positive might be encouragement, might be a little bit of rewards, where negative reinforcement would be punishment. So you're going to get written up if you're late, things that would actually punish the behavior that's being seen. Extinction is another method that managers can use in the reinforcement theory. Extinction is basically eliminating a positive reinforcer to get rid of bad behavior. So an example would be that could be used is complaining. So you have an employee that just constantly is complaining and complaining and complaining and complaining. Instead of acting on all those complaints, extinction would be just kind of ignoring all that complaining and not really paying it too much mind until that actually the behavior disappears. The unwanted behavior disappears because they're not getting the attention from the complaining. And the last method that can be used in the reinforcement theory would be shaping. So if a manager were to use shaping, they would be trying to provide positive feedback for behaviors that are getting closer to the desired behavior. So as the employee would start to make progress to being where they should be, they would get reinforced along the way to kind of shape the behavior into the way that they would expect their behavior to be. Expectancy theory is similar to the reinforcement theory, where it does place a lot of importance on rewards and how they can change a person's job's performance. Also in the expectancy theory, it does consider that there could be multiple outcomes. So an example would be if a staff nurse wanted to be promoted to a nurse manager. Yes, there would be positive change. You would probably get paid more. You would be in charge of more, but there could be also negative outcomes where You would have to put more time into your job. You would be in charge of more and responsible for more things, which could be negative things. In the equity motivational theory, the person actually believes that they are being rewarded for their job very similarly to other people performing the same job that they are doing. And then last is the goal setting theory. And this is a theory that is not a reward theory. So the person is actually performing because they have an ultimate goal. So their goal is ultimately what is motivating them to perform their job well. As we had said before, motivating staff is one of the primary responsibilities of the nurse manager. All employees that come to work kind of have expectations of what should be happening at work. First one would be fair pay. So no matter your race, your gender, people that have the same education and kind of the same work experience, they would be expected to be getting fair and equal pay. Adequate benefits, which is, like we said before, is really big in this day and age, that you feel like you have enough health benefits and that your family is secure in that way. Job security, so that if you do your job well, that you're going to continue to have your job and to continue to have opportunities. Of course, safe working conditions, and then fair policies and procedures. There are different approaches that the manager can take to be able to provide these things for their staff. One of the first things to do is to be very careful to hire competent employees. So taking the time to do good interviews and just making sure you're hiring people that get along with the other nurses in your unit and can also be very teachable. Clearly outlining the job responsibilities of the nurse before she comes to the floor and also once she is on the floor, so that she knows what her responsibilities are and that she can fulfill them. Utilizing incentive-based compensation, so just making sure that people are getting compensated for their work, for their overtime, those types of things. Giving clear and regular feedback on job performance. So just some encouragement, saying good job or thank you for working extra hours, thank you for orienting. Those things can go a long way for nurses. Lead by example. So just don't go around as the manager and tell people how to do things, tell people to help out, but actually get on the floor, be helping out, leading by example of how you want your staff to behave. Providing the tools that are needed for the job. So this might be asking for extra equipment, making sure the nurses have everything that they would need to do their jobs, making sure they have lifts for heavier patients, those types of things. And then providing flexibility to the staff's schedule. So being able to provide time off for appointments, for family emergencies, that kind of thing, and just trying to be flexible is big and is very helpful to motivate the staff. The next thing that we're going to talk about is staff development. So staff development begins as soon as a person is hired. Staff development includes orientation, on-the-job training, preceptors, sometimes a nurse residency program for graduate nurses, mentors and coaches, and also career progression and leadership development. Orientation involves learning, first of all, the organizational structure, specific expectations, and also the tasks of the job. Orientation generally begins with development personnel to discuss kind of information that is organizational wide. So it'd be benefits, missions, visions, policies, procedures, safety, those types of things. Next would come in the nurse manager, and he or she would focus more on information that is very specific to the nurse's job responsibilities, helping him or her to get familiar with the floor, with the other nurses, and just the type of work that they're going to be expected to do. A properly planned orientation can reduce a lot of the stress and anxiety that the new nurse would be feeling as he or she's coming to the floor. And socializing that new employee to the nursing unit can make the whole unit more effective. Making the unit more effective results in less dissatisfaction and less nursing turnover, which is really important. After orientation, the new employee would then begin on-the-job instruction. This is the most used method of staff development. This usually begins with the new nurse shadowing a peer or a preceptor, observing them and how they do their job, and then it would move into the new nurse actually performing the task while they're being supervised by that preceptor. When orienting and on-the-job instruction, it's really important that the nurse preceptor is carefully chosen and that the nurse preceptors are also receiving education on different teaching methods to make them more effective teachers for the new nurses. It's also important that nurses are rotated to different preceptors just to expose them to nurses that have different expertise and can provide additional information regarding the patients that they're going to be seeing. One of the other forms of staff development is the nurse residency program. So currently, the national one-year nurse turnover rate for newly licensed RNs is about 17.1%, and the two-year turnover rate is 33.5%. Both of those numbers are really high. I put here the average cost of a nurse turnover is between $37,700 and $58,400. So that is costing institutions a ton of money as their first and second year turnover rates are so high. That's why the nurse residency programs have been developed. And these programs are designed to help acclimate graduate nurses that are coming into the nursing profession. They usually last 12 to 18 months just to help support them. It has been proven that these nurse residency programs increase the retention rate of the new RNs, which is huge in decreasing, the overall costs of the units and for an institution. A popular form of career advancement is the clinical ladder. And these are promotions that recognize excellent nursing without moving the nurse into a form of management position. So these are nurses that are really loving their jobs, are providing excellent care, and they're getting compensated for their good care that they're providing. Clinical ladders generally have 4 levels, beginning with kind of the novice nurse, that would be the graduate nurse, and advancing to clinical ladder 4. The goals of the clinical ladder program would encourage professional development. It creates an effective reward system for improving clinical performance on the nurses. It strengthens the quality of the nursing that is being provided, and it is able to recognize staff nurses for their patient care. It can also be used to identify nurse role models. So this would be identifying like your preceptors and people that would be good in those types of roles. And it also improves the recruitment and retention of experienced nurses because they are getting recognized and some compensation for the good care that they're providing. So I just included this YouTube video. It's just kind of interesting. It provides for nurse managers or for any type of manager some very practical, low cost, and free ways to motivate their staff. Some of those things include listening, food Fridays, giving away gift cards, those types of things for employees that are doing good jobs. I just thought it was really neat and kind of interesting ways that nurses managers could help motivate their staff to be doing a good job and also encourage them along the way. And then I just included a little clip from the movie The Pursuit of Happiness. This has always been one of my favorite movies, and it's just a great example of motivation. So his motivation was his son and wanting to provide a better life for him. It's just a little clip where he kind of goes on and tells his son that he will never be good at basketball, and then he realizes that his son is so disappointed, and he changes his mind. He tells his son, if you want something, go get it, period. And that's the heart of motivation. So yes, we can have other people motivating us, but we need to figure out what we want and how we're going to get there, and just really put a plan in place to get ourselves to where we want in our lives and also in our occupation. So just a few questions here to ponder. What motivates you to do your best job each day? So for me, I personally have been a nurse for over 12 years, and my motivation has probably changed over those 12 years. So when I first started, I loved nursing. I loved taking care of people. I loved being busy. So I came to work every day, excited to be there, ready to work, ready to do a good job, ready to care for my patients. And a lot of that motivation is the same for me today. I'm doing home health now. I love going into the home, providing the best care that I can. But my motivation is probably more on a rewards basis. I work because I have to. I have to pay for the bills. I have to provide insurance for my family, and that is kind of why I work each day. And then the other question I kind of had is, which is the motivational theories describes how you are most motivated? So which of those theories is the reason why you do what you do? Just a thought to remember, motivation is not just the responsibility of your nurse manager. We all play a role in motivating ourselves and our coworkers.